Whether you're a psychology student studying for your abnormal psych final, someone prepping for the AP exam, or just someone who's ever wondered where the line is between a bad week and a real psychological disorder, you've come to the right place. In today's video, we're covering 80 abnormal psychology terms every student must know. We're going to define each term, walk through a clear example, and explain it in a way that's easy to understand and remember. By the end of this video, you'll understand how psychologists actually define and classify disorders, the major categories of anxiety, mood, psychotic, and personality disorders, and the treatment approaches used to help people manage them. One quick note before we start: this video is for education, not diagnosis. If anything here sounds like you or someone you know, that's worth a conversation with a real professional, not a label from a YouTube video. Welcome back to the Psychology Notebook. I'm Desiree, and this video is part of my Psychology Study Resource Series, where I cover hundreds of psychology terms to help you learn the science of psychology. Most terminology videos use my AI-assisted voice to keep the audio clear and easy to follow, especially for viewers studying psychology around the world. For more classroom-style lessons with my natural teaching voice, check out the full Psych 101 series and the lecture playlist for on-camera and behind-the-scenes content. Now, let's get into today's terms. Section 1. Foundations of Abnormal Psychology and the DSM. Before we get into specific disorders, we need the vocabulary psychologists use to define, classify, and study them in the first place. 1. Abnormal psychology. Abnormal psychology is the branch of psychology that studies unusual patterns of behavior, emotion, and thought, which may or may not be understood as constituting a mental disorder. For example, a researcher in this field might study why some people develop crippling anxiety in situations that don't bother most people at all. 2. Psychological disorder. Psychological disorder is a pattern of behavioral or psychological symptoms that impacts multiple areas of life and creates distress or impairment. For example, someone whose anxiety is so severe it keeps them from going to work or maintaining relationships may meet criteria for a psychological disorder, not just having a lot of anxiety. 3. The 4Ds. The 4Ds are the 4 criteria psychologists weigh when deciding whether behavior crosses into disorder: deviance, distress, dysfunction, and danger. For example, a behavior that's unusual, deeply upsetting to the person, disrupts their daily functioning and puts them or others at risk checks far more of these boxes than a quirky habit does. 4. The DSM-5-TR, or Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, is the standard classification system U.S. clinicians use to diagnose mental disorders. For example, a clinician diagnosing a patient will check the specific criteria listed for that disorder in the DSM-5-TR rather than relying on personal judgment alone. Diagnostic criteria. Diagnostic criteria are the specific symptoms, duration, and severity requirements a person must meet for a particular diagnosis. For example, a diagnosis of major depressive disorder requires at least 5 specific symptoms present for 2 weeks or more, not just occasional sadness. 6. Categorical classification. Categorical classification treats a disorder as something a person either has or doesn't have, based on a set cutoff of symptoms. For example, under a categorical model, someone either meets the criteria for social anxiety disorder or they don't. There's no in-between label. 7. Dimensional classification. Dimensional classification treats symptoms as existing on a continuum or spectrum from mild to severe, rather than as strictly present or absent. For example, autism spectrum disorder is described dimensionally, recognizing that symptoms and support needs vary widely from person to person. 8. Comorbidity. Comorbidity is the presence of 2 or more disorders in the same person at the same time. For example, it's common for someone with major depressive disorder to also meet criteria for an anxiety disorder, which is comorbidity. 9. Prevalence. Prevalence is the percentage of a population that has a particular disorder at a given point in time or over a specific period. For example, researchers might report that anxiety disorders have a lifetime prevalence of around 1 in 3 people. Incidence. Incidence is the rate of new cases of a disorder that develop within a population during a specific time period. For example, tracking how many new diagnoses of postpartum depression occur among new mothers each year measures incidence, not prevalence. 11. Etiology. Etiology refers to the cause or origin of a disorder, what leads to it developing in the first place. For example, researchers studying the etiology of schizophrenia look at genetic risk, brain chemistry, and environmental stressors together, not any single cause. 12. Biopsychosocial model. The biopsychosocial model explains psychological disorders as the product of biological, psychological, and social factors interacting together, rather than any one cause acting alone. For example, someone's depression might be shaped by genetic vulnerability, negative thinking patterns, and a stressful home environment all at once. 13. Stigma. Stigma is the negative stereotyping, prejudice, and discrimination directed at people with mental disorders, which often keeps people from seeking help. For example, someone might avoid therapy for fear of being labeled crazy by coworkers or family, even when treatment could help them. Now that we've covered how psychologists define and classify disorders, let's move into the most common category of all, anxiety disorders. Anxiety disorders. Anxiety disorders are the most frequently diagnosed category of psychological disorder, and this section covers the major types along with the vocabulary used to describe them. 14. Anxiety disorder. An anxiety disorder involves excessive fear or worry that is out of proportion to the actual situation and interferes with daily functioning. For example, someone with an anxiety disorder might feel intense dread about a routine work meeting for days beforehand, far beyond typical nervousness. 15. Generalized anxiety disorder. Generalized anxiety disorder, or GAD, involves excessive, persistent worry about a wide range of everyday events and activities, occurring more days than not for at least 6 months. For example, someone with GAD might feel chronically anxious about finances, health, and family, even when nothing is objectively going wrong. 16. Panic disorder. Panic disorder is characterized by recurrent, unexpected panic attacks, along with persistent worry about having more of them. For example, someone with panic disorder might start avoiding public places altogether, not because of the places themselves, but because of the fear of having another attack there. 17. Panic attack. A panic attack is a sudden surge of intense fear accompanied by physical symptoms like a racing heart, shortness of breath, and dizziness, usually peaking within minutes. For example, a person might suddenly feel certain they're having a heart attack, only for medical tests to reveal a panic attack instead. 18. Specific phobia. A specific phobia is an intense, irrational fear of a particular object or situation that leads to avoidance behavior. For example, someone with a specific phobia of heights might refuse to go above the second floor of a building, even when it's completely safe. 19. Social anxiety disorder. Social anxiety disorder involves intense fear of social situations where a person might be judged, embarrassed, or scrutinized by others. For example, someone with social anxiety disorder might avoid speaking up in class or eating in front of others out of fear of humiliation. 20. Agoraphobia. Agoraphobia is the fear of being in situations where escape might be difficult or help unavailable if something goes wrong, such as crowds, open spaces, or public transportation. For example, someone with severe agoraphobia may become unable to leave their home at all. 21. Separation anxiety disorder. Separation anxiety disorder involves excessive fear or distress about being separated from a major attachment figure, beyond what's typical for a person's developmental stage. For example, a child with this disorder might refuse to go to school out of fear that something terrible will happen to a parent while they're apart. 22. Obsessive compulsive disorder. Obsessive compulsive disorder, or OCD, involves a cycle of intrusive, unwanted thoughts and repetitive behaviors performed to reduce the anxiety those thoughts cause. For example, someone might wash their hands dozens of times a day to relieve the anxiety of an intrusive thought about contamination. 23. Obsessions. Obsessions are the recurrent, intrusive thoughts, urges, or images that cause significant anxiety in OCD. For example, a persistent, unwanted thought that the stove was left on, even after checking it, is a classic obsession. 24. Compulsions. Compulsions are the repetitive behaviors or mental acts a person feels driven to perform in response to an obsession, usually to reduce distress. For example, repeatedly checking that the stove is off, even after already confirming it multiple times, is a compulsion. 25. Post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, develops after exposure to a traumatic event and involves intrusive memories, avoidance, negative changes in mood or thinking, and heightened arousal. For example, a combat veteran might experience vivid flashbacks and an exaggerated startle response long after returning home. 26. Acute stress disorder. Acute stress disorder involves the same category of trauma symptoms as PTSD, but occurs within the first month after the traumatic event and lasts a shorter duration. For example, someone might experience acute stress disorder in the days following a car accident, and if symptoms persist past a month, the diagnosis may shift to PTSD. Now that we've covered anxiety disorders, let's move into a category that affects how people feel over time rather than how they respond to specific fears. Section 3. Mood disorders. Mood disorders involve significant disturbances in a person's emotional state, from persistent sadness to extreme mood elevation. 27. Mood disorder. A mood disorder is a psychological disorder characterized by significant disturbances in emotional state that impact functioning, ranging from deep depression to extreme elevated mood. For example, mood disorders include everything from major depressive disorder to bipolar disorder. 28. Major depressive disorder. Major depressive disorder involves at least one major depressive episode without any history of mania or hypomania. For example, someone with major depressive disorder might lose interest in activities they used to enjoy, sleep far more or less than usual, and struggle to concentrate for weeks at a time. 29. Major depressive episode. A major depressive episode is a period of at least 2 weeks marked by depressed mood or loss of interest, along with several additional symptoms like changes in sleep, appetite, energy, or concentration. For example, a person experiencing a major depressive episode might describe feeling emotionally flat and exhausted nearly every day. 30. Persistent depressive disorder. Persistent depressive disorder, also called dysthymia, is a chronic lower-grade form of depression lasting 2 years or more in adults. For example, someone with persistent depressive disorder might function day to day, but describe never really feeling good for years at a time. 31. Anhedonia. Anhedonia is the loss of interest or pleasure in activities that used to feel enjoyable or rewarding. For example, someone with anhedonia might no longer feel any excitement about a hobby, meal, or relationship they once loved. 32. Bipolar I disorder. Bipolar I disorder is defined by at least one full manic episode, which may be preceded or followed by episodes of major depression. For example, someone with bipolar 1 might go days with almost no need for sleep, racing thoughts, and grand plans, followed weeks later by a deep depressive episode. 33. Bipolar 2 disorder. Bipolar 2 disorder involves at least one major depressive episode and at least one hypomanic episode, without any full manic episodes. For example, someone with bipolar 2 might experience noticeably elevated energy and reduced sleep for several days, but never to the severity that disrupts their life the way full mania would. 34. Cyclothymic disorder. Cyclothymic disorder is a chronic mood disorder involving numerous periods of hypomanic and depressive symptoms that don't meet full criteria for hypomania or major depression, lasting at least 2 years. For example, someone with cyclothymic disorder might have a long-standing pattern of mild mood swings that never quite escalate into a diagnosable episode of mania or depression. 35. Manic episode. A manic episode is a distinct period of abnormally elevated, expansive, or irritable mood, along with increased energy, lasting at least 1 week. For example, during a manic episode, someone might go on an unplanned shopping spree, sleep only a few hours a night, and feel invincible. 36. Hypomanic episode. Hypomanic episode involves the same kind of elevated mood and energy as mania, but less severe and lasting at least 4 consecutive days, without causing major impairment. For example, someone in a hypomanic episode might seem unusually productive and upbeat to friends, without it disrupting their work or relationships the way mania would. 37. Seasonal pattern. A seasonal pattern, often called seasonal affective disorder, describes a recurring pattern of depressive episodes that occur at a specific time of year, most commonly during the fall and winter months. For example, someone might notice their depressive symptoms reliably return every winter and lift again each spring. 38. Postpartum depression. Postpartum depression is a major depressive episode that occurs during pregnancy or in the weeks following childbirth. For example, a new mother might experience overwhelming sadness, guilt, or detachment from her baby, well beyond typical baby blues. 39. Suicidal ideation. Suicidal ideation refers to thoughts of ending one's own life, ranging from passive wishes to not exist to active plans, and it's a symptom that appears across several mood and other disorders. For example, a clinician assessing a patient with severe depression will always directly ask about suicidal ideation because it significantly changes the urgency and plan for care. If you or someone you know is struggling with suicidal thoughts, the 988 Suicide and Crisis Lifeline is available 24/7 by call or text at 988. Now that we've covered mood disorders, let's move into a category where the disturbance isn't primarily in mood, but in the person's grip on reality itself. Psychotic disorders. Psychotic disorders. Psychotic disorders involve a break from reality, including symptoms like hallucinations and delusions. 40. Psychotic disorder. Psychotic disorder is a condition involving a loss of contact with reality, most often through hallucinations, delusions, or severely disorganized thinking. For example, schizophrenia is the most well-known psychotic disorder, but it isn't the only one. 41. Schizophrenia. Schizophrenia is a chronic psychotic disorder involving a combination of hallucinations, delusions, disorganized speech, and reduced emotional expression, typically emerging in the late teens to early 30s. For example, someone with schizophrenia might hear voices commenting on their actions that no one else can hear. 42. Positive symptoms. Positive symptoms of schizophrenia are excess or distorted experiences added on top of typical functioning, such as hallucinations and delusions. For example, hearing voices is considered a positive symptom, not because it's good, but because it's something added that isn't normally there. 43. Negative symptoms. Negative symptoms of schizophrenia involve the absence or reduction of normal functioning, such as flat emotional expression, reduced speech, or loss of motivation. For example, someone experiencing negative symptoms might show little facial expression and withdraw from activities they used to initiate on their own. 44. Hallucination. A hallucination is a sensory experience that feels real, but occurs without an external stimulus, such as hearing, seeing, or feeling something that isn't there. For example, auditory hallucinations, hearing voices when no one is speaking, are the most common type in schizophrenia. 45. Delusion. A delusion is a fixed, false belief that persists despite clear evidence against it. For example, someone experiencing a delusion of persecution might be convinced, with no evidence, that a government agency is monitoring their every move. 46. Disorganized thinking. Disorganized thinking refers to a disruption in the logical flow of thought, often reflected in speech that jumps between unrelated topics or becomes incoherent. For example, a person with disorganized thinking might answer a simple question with a string of loosely connected, hard-to-follow ideas. 47. Schizoaffective disorder. Schizoaffective disorder involves symptoms of schizophrenia occurring alongside a major mood episode, such as depression or mania, with psychotic symptoms also present independent of the mood episode. For example, someone might experience both hallucinations and a major depressive episode at the same time, but continue to have psychotic symptoms even once the depression lifts. 48. Delusional disorder. Delusional disorder involves one or more delusions lasting a month or longer without the other prominent symptoms of schizophrenia, and daily functioning outside the delusion often remains relatively intact. For example, someone might firmly believe, without evidence, that a celebrity is secretly in love with them, while otherwise maintaining a normal job and relationships. 49. Brief psychotic disorder. Brief psychotic disorder involves a sudden onset of psychotic symptoms lasting less than a month, often triggered by extreme stress, with a full return to normal functioning afterward. For example, someone might experience a short psychotic episode after the sudden death of a loved one, then recover fully within weeks. Now that we've covered psychotic disorders, let's move into a category that isn't about episodes that come and go, but about long-standing, rigid patterns of personality itself. Personality disorders. Personality disorders. Personality disorders involve enduring, inflexible patterns of thinking, feeling, and behaving that differ significantly from cultural expectations and cause distress or impairment. The DSM-5-TR groups the 10 personality disorders into 3 clusters. 50. Personality disorder. A personality disorder is a long-standing, pervasive pattern of inner experience and behavior that deviates from cultural expectations, is inflexible across situations, and causes distress or impairment. For example, unlike a mood episode that comes and goes, a personality disorder shapes how someone relates to nearly every part of their life, consistently, over years. 51. Personality disorders. Cluster A personality disorders are characterized by odd or eccentric thinking and behavior and include paranoid, schizoid, and schizotypal personality disorders. For example, people in this cluster often appear unusual or detached to others, though not necessarily distressed by it themselves. 52. Paranoid personality disorder. Paranoid personality disorder involves a pervasive, unwarranted distrust and suspicion of others, including assuming malicious intent behind others' actions without evidence. For example, someone with this disorder might assume a coworker's neutral comment was a deliberate insult. 53. Schizoid personality disorder. Schizoid personality disorder involves a persistent detachment from social relationships and a limited range of emotional expression. For example, Someone with this disorder might genuinely prefer solitary activities and show little interest in close relationships, including within their own family. 54. Schizotypal personality disorder. Schizotypal personality disorder involves acute discomfort with close relationships, along with eccentric behavior, unusual beliefs, or distorted thinking that falls short of psychosis. For example, someone might hold odd, magical beliefs about coincidences and dress or speak in ways others describe as eccentric. 55. Cluster B personality disorders. Cluster B personality disorders are characterized by dramatic, emotional, or erratic behavior and include antisocial, borderline, histrionic, and narcissistic personality disorders. For example, this cluster tends to involve the most intense interpersonal conflict and emotional instability of the three clusters. 56. Antisocial personality disorder. Antisocial personality disorder involves a pervasive disregard for and violation of the rights of others, often including deceit, impulsivity, and lack of remorse, and can only be diagnosed at 18 or older. For example, someone with this disorder might repeatedly break the law or exploit others without any apparent guilt. 57. Borderline personality disorder. Borderline personality disorder involves a pattern of instability in relationships, self-image, and emotions, along with marked impulsivity. For example, someone with borderline personality disorder might experience intense fear of abandonment, leading to unstable, on-again, off-again relationships. 58. Histrionic personality disorder. Histrionic personality disorder involves excessive emotionality and attention-seeking behavior, often including being uncomfortable when not the center of attention. For example, someone with this disorder might exaggerate emotional reactions or use physical appearance to consistently draw attention to themselves. 59. Narcissistic personality disorder. Narcissistic personality disorder involves a pervasive pattern of grandiosity, a constant need for admiration, and a lack of empathy for others. For example, someone with this disorder might react to mild criticism with disproportionate anger because it threatens a fragile, inflated self-image. 60. Cluster C personality disorders. Cluster C personality disorders are characterized by anxious or fearful thinking and behavior, and include avoidant, dependent, and obsessive-compulsive personality disorders. For example, this cluster tends to center around chronic anxiety, whether about rejection, being alone, or losing control. 61. Avoidant personality disorder. Avoidant personality disorder involves social inhibition, feelings of inadequacy, and extreme sensitivity to negative evaluation. For example, someone with this disorder might desperately want close relationships, but avoid them entirely out of fear of criticism or rejection. 62. Dependent personality disorder. Dependent personality disorder involves an excessive need to be taken care of, leading to submissive, clingy behavior and fear of separation. For example, someone with this disorder might struggle to make everyday decisions without excessive reassurance from others. 63. Obsessive-compulsive personality disorder. Obsessive-compulsive personality disorder involves a preoccupation with orderliness, perfectionism, and control at the expense of flexibility and efficiency. Unlike OCD, it does not involve true obsessions or compulsions. For example, someone with this disorder might become so fixated on doing a project perfectly that they never actually finish it. Now that we've covered the major categories of disorders, let's move into how psychologists and psychiatrists actually help people manage them. Section 6. Treatment approaches. This final section covers the major psychological and medical approaches used to treat psychological disorders. 64. Psychotherapy. Psychotherapy is the general term for talk-based treatment in which a trained professional helps a client understand and change thoughts, feelings, or behaviors. For example, psychotherapy can take many forms, from weekly one-on-one sessions to structured group formats. 65. Cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is a structured, present-focused therapy that helps people identify and change unhelpful thought patterns and behaviors. For example, a therapist using CBT might help a client with panic disorder challenge the catastrophic thought, "I'm having a heart attack," during an attack. 66. Psychoanalytic therapy. Psychoanalytic therapy, rooted in Freud's theories, explores how unconscious conflicts, often stemming from childhood, influence present-day thoughts and behavior. For example, a client might spend sessions exploring recurring dreams or early family relationships to uncover unconscious patterns. 67. Person-centered therapy. Person-centered therapy, developed by Carl Rogers, emphasizes unconditional positive regard, empathy, and genuineness to help clients reach their own insights and growth. For example, a person-centered therapist avoids directing the conversation, instead creating a safe space for the client to arrive at their own understanding. 68. Behavior therapy. Behavior therapy applies principles of learning, such as classical and operant conditioning, to reduce symptoms by directly changing behavior. For example, a behavior therapist might use systematic reward structures to help reduce a child's disruptive behavior. 69. Exposure therapy. Exposure therapy involves gradual, controlled exposure to a feared object or situation to reduce the anxiety response over time. For example, someone with a phobia of dogs might work through a hierarchy that starts with looking at photos of dogs and eventually progresses to being in the same room as one. 70. Dialectical behavior therapy. Dialectical behavior therapy, or DBT, combines cognitive behavioral techniques with mindfulness and emotion regulation skills and was originally developed for borderline personality disorder. For example, a client in DBT might learn specific skills for tolerating intense emotional distress without engaging in harmful behavior. 71. Group therapy. Group therapy involves one or more therapists working with several clients simultaneously, allowing members to support and learn from one another. For example, a support group for people coping with grief allows members to feel less alone in their experience. 72. Family therapy. Family therapy treats psychological issues within the context of the family system, working with multiple family members together rather than just the individual. For example, a family therapist might help a family understand how their communication patterns are contributing to a teenager's anxiety. 73. Psychopharmacology. Psychopharmacology is the study and use of medications that affect mood, thought, and behavior by acting on the brain's chemistry. For example, a psychiatrist practicing psychopharmacology decides which class of medication and at what dose is most appropriate for a patient's specific symptoms. 74. Antidepressants. Antidepressants are medications used to treat depression and several anxiety disorders by adjusting levels of neurotransmitters like serotonin and norepinephrine. For example, SSR is a common class of antidepressant, work by increasing the availability of serotonin in the brain. 75. Anti-anxiety medications. Anti-anxiety medications, or anxiolytics, are used to reduce the physical and emotional symptoms of anxiety, often providing more rapid relief than antidepressants. For example, benzodiazepines are a fast-acting class of anxiolytic, though they're generally prescribed for short-term use due to dependency risk. 76. Mood stabilizers. Mood stabilizers are medications used primarily to manage bipolar disorder by reducing the intensity and frequency of both manic and depressive episodes. For example, Lithium is one of the most well-established mood stabilizers used in treating bipolar I disorder. 77. Antipsychotics. Antipsychotics are medications used to reduce psychotic symptoms like hallucinations and delusions, primarily by affecting dopamine activity in the brain. For example, antipsychotic medication is a core part of treatment for schizophrenia, often alongside psychotherapy and social support. Electroconvulsive therapy. Electroconvulsive therapy, or ECT, is a medical procedure that induces a brief controlled seizure under anesthesia and is used for severe depression that hasn't responded to other treatments. For example, ECT is sometimes used for patients with severe treatment-resistant depression, and modern ECT bears little resemblance to how it's often portrayed in older films. 79. Deinstitutionalization. Deinstitutionalization refers to the mid-20th century shift away from long-term psychiatric hospitalization toward community-based mental health care. For example, deinstitutionalization dramatically reduced the population of state psychiatric hospitals, while also creating new challenges around access to consistent community-based care. 80. Evidence-based practice. Evidence-based practice means using treatment approaches that have been rigorously tested and shown to be effective through research, rather than relying on tradition or personal preference alone. For example, a clinician choosing exposure therapy for a specific phobia is following evidence-based practice, because decades of research support its effectiveness. Thanks for joining me on this guide to 80 abnormal psychology terms. If you found this video helpful, be sure to like, subscribe, and share it with anyone else who might be studying for an exam or just curious about how psychologists understand and treat mental disorders. Don't forget to watch the full terminology playlist. It is a huge library of psychology terms to help you study, review, and feel more confident as you learn psychology. If you want to go deeper, check out the Mega Psychology Flashcard Pack and my study resources and tools. The link is below. And according to YouTube, this video is perfect for you on your learning journey. Click it and I'll see you over there.